Good evening, and thank you for joining tonight's telephone town hall meeting hosted by Jefferson County Public Health. I'm Roger, and I'll be your moderator tonight as we discuss updates on the COVID-19 pandemic and heading back to school. Our presenters and available panelists this evening include Congressman Ed Perlmutter, Tracy Kraft-Tharp, Jefferson County Commissioner, Dr. Don Comstock, Jefferson County Public Health's Executive Director, Dr. Mike Davis, Head of School at Colorado Academy, and Kelsey Hall from the County Attorney's Office. Before we begin, I want to take just a moment to tell you about the format for tonight's interactive call. We realize that some on the call just want to listen, and that's perfectly fine. But for those of you that want to ask a question, please press *3 on your phone, and you'll be transferred to an operator who will take down some basic information. Once the operator notes your information, you will be returned to the call and can listen to the conversation until you are called upon. So go ahead and press *3 now if you already know your question, and this is the same process to follow throughout the evening. If you hear something that generates a question, just press *3. Since we want to answer as many questions as possible, we'll limit all callers to only one question, and when it's your turn, I'll call your name and ask you to repeat your question for our live audience. Some of you have already submitted questions online before joining this evening, so we're going to try to answer those questions throughout tonight's call as well. Now it's my pleasure to turn over the event to Congressman Ed Perlmutter for some opening remarks. Congressman, welcome.
Thank you, Roger, and thanks to Jefferson County Public Health and Dr. Don Comstock for inviting me to participate in tonight's telephone town hall. As many of you know, I'm the congressman for the 7th Congressional District, which is the north half of Jefferson County and the west half of Adams County, and I've held a number of telephone town halls, and Dr. Comstock has been kind enough to join me in those, and I wanted to participate in the one tonight to answer any questions that you might have or that your listeners might have regarding federal matters generally. And as many of you, I probably share the same disappointment to see the virus not having, been eliminated and to not be in our lives. And obviously this Delta variant seems to be pretty darn aggressive and very transmissible, so we have to continue to be wary of it and to take precautions across the board to deal with it. And, one of my main messages to all of you is to please get vaccinated. If you haven't been vaccinated, please get vaccinated. That will help you individually and will help our community generally, because it will make it more difficult for this virus to continue to transmit. Now, at the federal level, we've done a number of things from the CARES Act, which occurred last year to kind of help our communities, our states, and our nation weather this pandemic storm. We continued that with the American Rescue Plan, which the Congress passed in March of this year, March and April, which has substantial help to individuals, to their families, to local governments and school districts, as well as the state government. So, for instance, individuals, if you've got children, you're entitled to a tax cut under the Child Tax Credit Program. There is money for people who are renting and have fallen behind in their rent. There is substantial sum of money for school districts and state governments to improve architecture and the building facilities. So the American Rescue Plan has a lot of assistance for our state and individual families, and we want you to take advantage of that. I know many families, students, parents, teachers. My wife is a teacher here in Jeffco Public Schools, are anxious about the upcoming school year as this virus still exists. And, everybody's just going to have to be careful. We want to have in-person learning. And I can tell you, as the husband of a teacher, she really knows how much she enjoys teaching in person and believes that she's a better teacher and her students learn more in that respect. So I look forward to your questions tonight. These are challenging times, but together we will get through this. And I look forward to these questions. And I just want to thank those that have been on the front line for so long, among them our doctors, our nurses, our public health and other healthcare workers, our firefighters, our law enforcement folks, and obviously our teachers who, have been working through some circumstances that none of us have ever had to deal with before, except for maybe 1918. So with that, Roger, I'll turn it back to you and let you proceed either with questions or to our next speaker.
All right. Thank you, Congressman. Let's take some questions for Congressman Perlmutter. And as a reminder, you can participate in the discussion by pressing *3 on your telephone. You'll be transferred to an operator who will take down some basic information and get you in the queue. So again, *3 on your phone to ask a question. The first question we're going to go to was submitted online, and it was directed towards the Congressman. And that question is as follows. A lot of people in our community are still struggling after a year and a half of challenges because of COVID-19. What is the latest news on COVID relief for those families? Congressman, go ahead.
Sure. Thanks for that question. As I was saying, the American Rescue Plan, which the Congress passed and President Biden signed at the end of March, beginning of April, is really designed to help individuals, businesses, nonprofit organizations all across the board to deal with COVID and its consequences. So from a healthcare perspective, there is additional funding, obviously, for vaccines and vaccine development and refinement, so that as the virus continues to mutate, as it has done with this Delta variant, we can stay ahead of it. And so there's the healthcare component, as I mentioned earlier. There's a housing component for those people who've fallen behind in their rent. There's assistance for them, for businesses. We have been providing assistance, as we did similarly under the CARES Act, to small businesses. There's a substantial amount of money for restaurants and other businesses in the hospitality area, so movie theaters, arts centers, museums, things like that, zoos, to help them continue to navigate this pandemic. There are so many things in that. If an individual or a family has some concerns and needs some assistance, please feel free to call our office at 303-274-7944.
All right, thank you. Let's go to a caller.
Roger, I should add, there are two things that are on the table right now between the infrastructure package that the Senate just passed and this the American Family Plan, which is under consideration in the House as well. There will be substantial assistance for jobs training, for, again, Medicare, Medicaid. Healthcare will be a big component of these bills. And then in the infrastructure bill to work on water systems and schools, reconstruction of schools, there will be, again, a lot of assistance in some very substantial legislation that is currently underway, past the Senate, is moving to the House.
All right, thank you for that information. Let's go to a caller. We're going to hear from Christy next. Go ahead.
Great. So my question is, it seems like there's been a little bit of punting between the state, between the health department, between the school districts for requiring the science-backed multi-layered approach that we know is effective in slowing the spread of COVID. And I really appreciated the recommendations from Jeffco Public Health Department a few weeks ago, which kind of really included and really spelled out what those evidence-backed, multi-layered approaches would look like as we're looking at sending our students back to school. But those were really not adopted by the school district in the latest guidelines by the district, like even what it's been watered down even more. And I'm really looking for some leadership from the health department. I'm really hoping we can be proactive and not reactive in keeping our kids safe and in school with minimal disruption. And so my question, I think, is really for Dr. Comstock, and I'm wondering, what are you looking for to make these recommendations requirements in the form of a public health order? Just since the recommendations from the public health department have been so kind of thorough and robust and have not been picked up by the health department.
Thank you. Doctor, go ahead.
Yeah, thank you, Christy. That's a very good question, and I've received that question from several parents who have emailed me. The overarching goal, of course, is to keep children in person this academic year. We know that our kids just suffered so much last year with the all too frequent disruptions due to isolations and quarantines and outbreaks and sometimes even school closures. So the Jefferson County Public Health School guidance that was released strongly recommended that layered approach to viral mitigation with that eye toward identifying how we could best keep kids in school in person. As you noted, not all schools adopted that regulation. Not all schools adopted those recommendations. The actual regulations or the rules at this point are being set by each school. My staff and I, though, will keep a very, very close eye on COVID transmission in the schools as the new school year starts. If schools are successful in identifying the viral mitigation strategies that work best for them and their school populations, and case count stays low, then it's good. However, if we start seeing the case numbers in schools that are exceeding what we see in the general population, or if we start seeing outbreaks in schools, at that point, if we can't convince our schools to voluntarily adopt all of the recommendations that we've made, at that point, I will have to put a public health order in place.
Again, *3 if you'd like to ask a question. We're going to go back to a question submitted in advance, and this is for the Congressman. Nikki asks, the governor of Kentucky issues a mask mandate for everyone entering public schools in the state, regardless of vaccination status. Kentucky is not known for their progressive policies. So why are we in Colorado doing less to protect our kids? How does what we're doing in Colorado stack up against other states? Congressman?
Nikki, thank you for that question. No, Kentucky is not known to be progressive, but they do have a progressive governor. And he, I think, has, been keeping an eye on the status of this Delta variant in Kentucky, which is very high. I mean, a number of states have really experienced much greater transmission of the virus than we have to this point. Texas, Florida, Mississippi, Arkansas, Missouri. I think Kentucky is up there too. So, he, the governor, has taken a very strong stance. And our governor, Polis, has had mask mandates in the past. He has taken some strong stances. But at this point, and I think he was on TV today with a press conference, he is still encouraged, even though we're seeing a rise of this darn variant here, there's still a lot of cushion in our hospitals, which is something he looks at closely, and the positivity rate and all of that stuff. But, Kentucky has decided to chart a slightly different course. We'll see how things proceed here. On a state-by-state basis, Colorado stacks up pretty good against the rest of the country. Now, that's not to say we haven't suffered our real surges with the virus. We were one of the early states with the virus, in part because we have so many people that come to Colorado from all over the world, especially to our ski areas. And we saw that in the mountains, had very high rates before much of the rest of the country. It died down, but then we had a big surge in November of last year. And since then, we've been doing pretty good, but we've got to watch this closely, as Dr. Comstock said. And I know she and the state health department and obviously the CDC and federal agencies are watching this Delta variant, which really is the main virus that we face here in Colorado, just to try to keep it as in check as best we can. So I think we're doing pretty well. I think President Biden is probably more amenable to doing some national steps if necessary than President Trump was. But we'll just have to see how this proceeds. So I appreciate that question, but I think Colorado stacks up pretty well. And so far we're doing okay, but we've got to watch this closely.
All right, very good. Thank you. Let's go to a live caller and take a question from Alexis. Alexis, go ahead.
Hi, thank you very much. Hello.
Hi, Alexis.
Hi, thanks. I wanted to bring about that COVID poses almost no risk to our kids. There are 4.2 million children that have tested positive, with a death percentage of 0.008. The 2018-2019 season for flu killed 480 children.
Oh, I'm gonna jump in, Alexis. I think you wanted to ask a question about protocols for masks in school. Don and Mike, do you want to talk about that?
Sure thing. This is Mike. Yeah, go ahead, Don. You go.
No, please, Dr. Davis, I'll let you go first.
Yeah, so it's a great question, and I run Colorado Academy. It's a private school, and it's a question we think about a lot. And I think for me, my school's pre-K through 12, so I automatically have half of my population who is ineligible for vaccinations, and yet our grades 7 through 12, we have about 90% of our students have submitted documentation of vaccination. And I think we're looking very carefully at this. We want to prioritize in-person learning. We think that's so important. And what we learned last year is masks work. The data is totally conclusive that will prevent us from closing, from shutting down. It allows us to be in person. So I'm looking, as I make my decisions for what we're going to do with our community, I'm looking at what was going to keep us in operation as much as possible. And Alexis, I appreciate your question and what you began with, but the reality is, kids can suffer from this. And also I look at it in terms of our role as a school, in terms of the larger community health, of how do we limit hospitalizations? How do we make sure people have access to ERs and ICUs for other illnesses? And we can prevent this. And so all those things factor into our decision making. And we're also looking at the larger rates. And my hope is when rates go down in the state, we can relax some mask mandates that we might impose at our school. Dawn?
Yeah, thank you, Dr. Davis. So this is Dr. Comstock with Jefferson County Public Health. It's a very good question. How are we deciding when masks should be in schools? Again, I know it varies widely across the Denver metro area and across our state. Some counties, the public health directors have put in public health orders that mandate mask wearing for all students in schools, either all or all students of certain age groups. Thus far in Jefferson County, I've really tried to provide strong recommendations and to work with schools to encourage them to put in the rules that they believe are best for their student body, while really trying to express how strongly we recommend mask wearing for all in schools. Again, as I mentioned with the previous caller, we're watching closely, and we will turn that into a public health order requiring masks if needed. However, what decision making was behind it? Well, there's just a growing body of very clear research now that demonstrates that masks are effective. In fact, Children's Hospital Colorado, a source that's been so trusted by you parents and caregivers for decades and decades here in Colorado, Children's Hospital released a document that reviewed the research on mask wearing in schools, and I'm going to just read one of their main points. I'm reading this directly from this document from Children's Hospital. It says, school-associated COVID-19 transmission is low when risk mitigation measures, including universal masking, are used. Schools with universal masking policies experience an extremely low secondary transmission rate, only 1 to 4%, as compared to schools without masking, which see secondary transmission rates between 11 and 27%. So the decisions that we've made about strongly recommending masking come from the scientific evidence as well as the strong recommendations of leading medical and public health authorities in our country. Both the American Academy of Pediatrics and the Centers for Disease Control and Prevention have strongly recommended universal masking in schools this year. And like Dr. Davis, Alexis, I'm sorry you got cut off, but it is very important to address this misperception. Children are at risk of being infected with COVID-19, and they are able to spread COVID-19 to others. Thankfully, the vast majority of children who are infected are asymptomatic or have relatively mild cases, but some children have serious cases. They end up hospitalized. They are, unfortunately, some fatalities. We're seeing across the country right now in states with higher case rates than us, we're seeing the increase in the number of children who are hospitalized. Just as importantly, those kids can transmit virus to others, and they can transmit to individuals who are not able to be vaccinated. They can transmit to people who are fully vaccinated and cause a breakthrough case. So I don't look only at fatality data because, quite frankly, it's my job to make sure that we never get to the point where children are dying. It's my job to make sure we're preventing infection if we can.
All right. Thank you, Doctor. Let's take a quick break from questions. Hear from Commissioner Kraft-Tharp. I know she's got a few things to talk about. Commissioner, go ahead.
Thank you, Roger. Congressman Perlmutter, good to hear from you, and thank you, Dr. Comstock, for inviting me to be part of this call. I just want to jump in and say hello, welcome everybody. So it's been a long 15 months. I want to express my admiration for all the parents, all the caretakers in our county who've been working so hard to help keep your kids safe throughout this pandemic, and I know it hasn't been easy. It's fall. Going back to school is exciting. It's a special time for both families and young people. On behalf of the Board of County Commissioners, I am so glad that in-person learning will be prioritized and will be protected this year. Jefferson County Public Health has worked very hard to help lead our county through COVID-19 pandemic, and we support their work to keep students and educators healthy at school so students can learn in person again. I am looking forward tonight to hearing from you during this call. Remember to press *3 to be able to ask a question. And with that, I'm going to turn it back to Dr. Dawn Comstock, our Executive Director, so she can talk with us a little more about the back-to-school information. So thank you.
Roger, please take it away.
All right, thank you. Why don't we take? Oh yeah, let's see. I think it is. We're back to you, Doctor, and then we'll get back to some questions.
All right. Well, thank you, Roger. First, to everyone on the call, I just want to thank you for taking time out of your evening just to be here to share your questions and your concerns with us and to enable us to share some information with you. I understand everybody's incredibly busy, and this time, these many months of battling COVID have caused such anxiety and stress, and I thank you for being here. As young people head back to school, we want to offer an opportunity to discuss JCPH's guidance for schools and child care settings and provide some insight on the data and evidence driving our recommendations. Most importantly, we wanted to offer time for open discussion with you, with the parents and caregivers of our Jefferson County children, so you can ask questions, perhaps even share your concerns. I wholeheartedly support in-person learning, and I understand how critical it is that young people are able to get back into the classroom. They need to be able to see their friends in person. They need to be able to interact with their teachers in person. I'm committed to emphasizing, prioritizing, and protecting in-person education this academic year. Young people have already missed out on far too much as their lives were upended during the last school year. Like you, my priority is to help kids get back to school to ensure that they're able to thrive in a healthy, safe environment. That's why Jefferson County Public Health has worked in partnership with CDC, CDPHE, other local public health partners, and our communities to try to determine an evidence-based approach for heading back to school with COVID-19. With some key mitigation strategies, we know we can keep students and staff as healthy and safe as possible, especially with the more transmissible Delta variant taking hold here in Jefferson County. We simply have to work together. I did want to give a quick situation update on what is going on with the Delta variant and COVID here in Jefferson County by sharing some Jefferson County specific data that is informing our recommendations at this time. Unfortunately, while we made a lot of progress over the summer months, we're now moving in the wrong direction again. As a trained epidemiologist myself, it's essential to me that guidance from Jefferson County Public Health is always developed based on the existing and emerging scientific evidence and expert and national, state, medical, and public health guidance, as well as current disease data in our country. My goal is to ensure disease mitigation strategies recommended or required by JCPH are evidence-based. So what's the local evidence that I use? Here's some data and COVID-19 trends that are happening in our community here in Jeffco right now. Overall, COVID-19 incidence in the county is increasing rapidly. The 7-day incidence rate in Jeffco rose from 23.3 per 100,000 on 7/12 to 102.7 per 100,000 today. And the 14-day average hospitalization rate rose from 0.26 per 100,000 on 7/12 to 0.8 per 100,000 today. These two important metrics both more than tripled in just 1 month. And students have not yet returned to the high-density indoor settings of our schools. Incidence rates among school-age children are also increasing rapidly. In July, the incidence rate in our school-age children mirrored the incidence rate among adults. The Delta variant has quite literally changed the playing field in this ongoing fight against COVID-19. And sample testing conducted by our state health department, CDPHE, shows that the Delta variant is now responsible for over 95% of all COVID-19 infections here in Colorado. Unfortunately, vaccination uptake is simply not where it needs to be right now to protect our children as they return to school. As of August 1st, only 58.7% of Jeffco residents between the ages of 12 and 19, those school-age children, have been vaccinated. The evidence is now clear and overwhelming and indisputable. Vaccinations are safe. Vaccinations are effective, both in reducing the risk of becoming infected and, among breakthrough cases, those who become infected even though they have been vaccinated, in reducing the severity of their illness. Most of the new cases among individuals here in Jefferson County who are among individuals who are unvaccinated, either because they're not eligible for a vaccine or because they're still just choosing not to get a vaccine. Specifically, out of the 1,318 total cases of COVID-19 in Jefferson County in July, 69.7% were among individuals who had no vaccine. And another 5.5% were among individuals who were only partially vaccinated. Additionally, the overwhelming majority of those in Jefferson County who continue to die from COVID-19 are unvaccinated, and every individual under the age of 20 hospitalized due to COVID-19 here in Jefferson County was unvaccinated. Another way to look at how this virus is affecting our community and who is being affected is by comparing incidence rates across risk strata. Clear and distressing patterns emerge when we compare incidence rates among vaccinated versus unvaccinated individuals. In July, here in Jefferson County, the COVID-19 case rate among unvaccinated individuals 12 or older was 566.7 per 100,000. The rate among partially vaccinated individuals who had only one of two doses or had both doses but became infected before that 2-week period after their second dose, their incidence rate was 226.8 per 100,000. And the incidence rate among kids under the age of 12 was 155.2 per 100,000. On the other hand, the case rate during that same time period among fully vaccinated individuals was only 66.8 per 100,000. This is now truly a pandemic of the unvaccinated, and together we need to do everything we can to increase vaccination rates among young people eligible for vaccination while protecting those still too young to be vaccinated. Next, in addition to the current data, I want to share what other evidence is supporting my decisions. The American Academy of Pediatrics has recommended a layered approach to viral mitigation in schools, including promoting vaccinations and masking, to make schools as safe as possible for all students, teachers, and staff. Additionally, the CDC recently released a scientific brief called Cdc Science Brief, Transmission of SARS-CoV-2 in K-12 Schools and Early Care and Education Programs. That brief goes through almost 100 peer-reviewed scientific papers that support layering viral mitigation strategies, including vaccination, masking, screening, testing, isolation, quarantine, and more. And finally, CDPHE has released a guide for operationalizing that CDC guidance. I won't go through all the research this evening. There's simply too much of it, but I want to make sure you're aware of these resources and really understanding that our goal, which I know you share with us, is trying to ensure that our school children can return to in-person classrooms and can avoid those disruptions due to isolation, quarantine, and outbreaks that occur when we have viral transmission in the school setting.
All right. Thank you, Doctor, for all of that great information. Let's take a few minutes to ask and answer some more questions. We're going to hear next from Nishant. Go ahead. They dropped off. All right, let's go to David next then. David, go ahead.
Well, I think you already answered my question on why mask the children when they're so low risk. But are you guys going to move to force vaccinations on the children?
Yeah, hello, David. Thank you so much. There are no requirements at the state or any county level here in Colorado, nor at the federal level, to require vaccination for children at this time. As you know, if you're a parent or caregiver of a child, the state of Colorado does have a list of vaccinations that children are required to have before they enter school, but there is a process through which parents can request a religious exemption, medical exemption, or personal exemption. I do strongly believe that once there is a vaccine that has full FDA approval for COVID-19, I strongly believe the state will likely add that to the list of those vaccinations required for students, right along with those vaccinations that students already get before they go to school, like measles and pertussis. But no, at this point, There are no requirements for vaccinations for students, and I am definitely not planning on requiring that. That's a decision that happens at the state level. Thank you for your question, though.
All right, let's go to a question that was submitted by a parent in advance of the call. Here's her question. My kids are anxious and panicked about contracting and spreading COVID. Can I provide them reassurance that they are, statistically speaking, safe at school? I'm heartbroken seeing them this upset.
Yeah, I'll take that one. This is Dr. Comstock again. I completely understand. COVID has been stressful and anxiety-producing for everyone. It's affected every single member of our Jeffco community, our societies, and particularly so for children because their education was so disrupted. That's precisely why we're all working so hard to make sure that they can be back in-person learning uninterrupted this academic year. So can you provide them reassurance that they're statistically speaking safe at school? Well, I shared the data provided by Colorado Children's Hospital in their review of masking in school, and showing the decrease in transmission rates from 11 to 27% in schools without masking down to 1 to 4% in schools with universal masking. I think how safe your child is at school, quite frankly, depends on what viral mitigation techniques your school is implementing. And that's one reason why in my recommendations to schools in the released JCPH school and child care guidance, I strongly recommended that schools should be transparent and honest with parents, and they should be sharing with you what the vaccination coverage is of their faculty and staff. They should be sharing with you what the vaccination coverage is of the other children 12 and over in your school. And they should be sharing with you what their masking policy is and how they'll enforce it. And finally, they should be sharing all of the other viral mitigation efforts that they're layering to try to protect your child. I understand as a parent, I truly understand that you are passionate about making decisions that you feel are right for your child. And being able to see which schools are implementing which viral mitigation strategies can help you make those decisions, I hope.
Okay, let's hear from Diane next. Diane, go ahead.
Yes, been listening to all of this, and I think it's wonderful, and all of you are positive about what you're thinking and what you're doing. Personally, I think it should be mandated that children be wearing masks in school if they're not. And if they're over 12, they should have their shots. And all the teachers and all the staff should have their shots, be vaccinated, to keep everyone from getting sick. But besides the shots and the masks, have you all over the summer worked on any ventilation in the schools? Some of the schools are newer, but some of the schools are older. And proper ventilation and all that is a helpful thing in conjunction with the mask.
Can I jump in and take part of that question for Diane? This is Ed. As I said earlier, at least on a national level, we recognize whether it's at an airport or in a school or in a public building, heating and ventilation there's a key component here, and there have been a number of strides that have been made over the course of the last year, especially in dealing with sort of the lighting systems, heating and ventilating systems to minimize, germs that are in the air, including this virus. And so as part of the CARES and the American Rescue Plan, there is money to assist governments, local governments, school districts, state governments, in terms of their engineering and architecture for different public buildings. The same thing applies if we're able to pass this big infrastructure bill and the American Families Plan. There is additional assistance to public entities across the country to try to upgrade all of their HVAC and lighting systems to make them as so they can prevent as much transmission of germs as possible. And that also applies to the water system. So there is, at a federal level, an effort to provide funding to make these things happen. So Diane, thank you for that question.
All right, thank you. Lance, it's your turn. Go ahead.
Yeah, I'm just curious. You guys keep talking about the COVID variant. How are you guys testing for that? Like every time somebody gets tested, are they testing for all 6 variants that are out there now? Like it seems like we can't even get one test right, and somehow you guys are testing for 6 different variants. So please expand.
Thank you, Lance. That's a really great question. So the way that they test for variants is specific laboratories. The main one here in Colorado is at our state health department, CDPHE. They take the sample, the test sample that you submit when you get tested, after it goes through the regular laboratory just to see if you're COVID positive or not. If you're COVID positive, they send that sample to the state health department, and the state health department does what's called full genome sequencing. They literally look at the genetic pattern of the COVID virus that was in your specific sample, and they can compare the pattern of the genetics of your sample to the known genetic pattern of each of the different variants. So it's actually incredibly specific and accurate, and that's how we identify these new variants as they emerge. We know that we had the initial strain of COVID-19, and there have been several different variants that have been identified subsequently. The CDC keeps track of which ones rise to the level of being determined to be a variant of concern. The most recent variant of concern that had a large impact on us here in Colorado was the UK variant, and now clearly the Delta variant has taken over. So yeah, that's exactly how it works. They don't test every single sample, every single test sample. They look at a representative sample of all of the tests that have been submitted by people all across Colorado. They run those through that full genome sequencing, and that allows them to look at which variant is being transmitted most strongly or most highly across Colorado at any given time. In fact, for anyone that's on the call today, you can actually go to the State Health Department's website, and you can see there's a section on their COVID-19 dashboard that's specifically devoted to variants. You can actually look up which variants are circulating in your county right now. So you can see which variants are predominant in Jefferson County versus Douglas County versus Mesa County, for example. That's a really good question, and thank you very much, Mike, for giving me an opportunity to explain that.
Okay, Christy is next. Go ahead. Oh, we lost Christy. Let's go to Greg. Greg, you're live. Go ahead with your question.
Yeah, my question is, what's being done to monitor the mental health of the students as they're being required to wear masks? Has anybody done any quantifying on the suicide rate or the depression rate of these children?
Thank you, Greg. This is Dr. Comstock again. I definitely understand children have also been affected so strongly by COVID and how long we've been fighting this pandemic. And I appreciate that the disruptions that they faced last year were just incredibly hard on them from an academic achievement perspective, from their social development perspective, and definitely from their mental wellness perspective, their mental health. That constantly being pulled out of school, being subjected to remote learning, it was really, really hard on our kids. Specifically, that's why we're working as diligently as we are to try to find the right combinations of viral mitigation strategies so we can avoid those disruptions. We know kids' mental health is better when they're in school, and we want to make sure that they can stay in school, that we don't have any kids that have to be subjected to remote learning or that have to keep being pulled out of school for isolations, for quarantines, for outbreaks. So everything that we're doing is to try to keep them in that in-person school environment because we know just how crucial it is for their mental wellness. I know that several parents have emailed me quite concerned about potential increase in suicide. We looked at the data over the last decade here in Jefferson County, and actually our suicides among youth decreased last year. I know several people believed that they increased dramatically last year, but our data actually shows that suicides decreased slightly among youth. We keep track of kids 11 through 18, or it might be 11 through 19, I'm sorry, I'll double check. But that age group, the suicides actually decreased slightly in 2020. So very conscientious about mental wellness. I understand that some children don't like wearing masks. Most of them are quite resilient. Some children definitely don't like wearing masks, but I truly believe that the mental wellness impact of not being able to be in school with their friends and with their teachers is more concerning than the impact of wearing a mask. And this might be a great call for Dr. Davis to step into, since I know as a school leader, he is very concerned about the mental wellness of his students.
I'm glad you brought me in. I would say what was really interesting about, first of all, we should acknowledge that even pre-COVID, we have suicide is the leading cause of death for adolescents, or second leading cause of death for adolescents in this country. We were already in a national crisis zone. The data is really interesting because I had a lot of parents worried about it. And what we found, what was really interesting at our school, and we have a great mental health staff, and we really monitor this at our school, is that the kids who we were concerned about before, the anxious kids, depressed kids, COVID was actually not that bad because all of a sudden they were out, they were either virtual or in a hybrid situation, and they avoided a lot of the stuff that happens in the normal course of a school day, the kind of passing period drama, and kind of protected from that. And they kind of like that. They're more introverted maybe. And those kids did better. It was our extroverted students who struggled. And again, it's all about supporting. There's been some interesting data that their suicide attempts nationwide have reported to go up. But part of the reason they weren't successful was because actually parents were with their kids and more involved and being able to kind of pull kids back. And I agree with Dr. Comstock. The data actually shows suicides went down in this country for teenagers. I think we need to remember kids, they thrive off of being one another. So I think if they have the choice between being in school with a mask on versus being hybrid or online, it's an obvious choice. And particularly since we know we can be outside maskless, it's a big win. So I think we learned a lot of interesting things through this pandemic. And I'm certainly at my school thinking about how do we address some things differently for all of our students to improve their mental health. And I think all parents, regardless of how we view this pandemic from a political perspective or a scientific perspective, we have to focus on mental health and wellness. And I have a lot of confidence in the resiliency of students.
If I could just jump in for a second, this is Ed again. In the American Rescue Plan, and Greg, thank you for your question, but generally we are very concerned about people's mental health and behavioral health. There is a substantial amount in terms of resources for our mental health community. So say Jeffco Mental Health or Center for Mental Health, there will be assistance so that they can deal with any influx in behavioral health issues. The schools will also have some additional assistance in that regard. So it is something I think is on everybody's radar, and there will certainly be studies to determine what effect did this, that, or the other thing have on people, whether they got laid off because they worked in a restaurant or they're in a school and they were quarantined for a bunch of time. But we recognize this, and so the rescue plan has substantial resources for the state and local governments to deal with people's mental health.
All right, thank you, Congressman. Let's hear from Jennifer next. Jennifer, go ahead.
Yes, I was wondering, does anybody know when vaccinations will be 12 and under for children?
Hi, Jennifer. This is Dr. Comstock here. I wonder if Congressman Perlmutter has maybe better information than I do, since he's on the Hill. What we've been told by our counterparts at the State Health Department and what's trickling down to us at the local public health agency level is that we should be able to expect emergency use authorization for vaccination for children under the age of 12 sometime late this fall into this winter. So I think we're looking at November, December-ish. I'm just not sure if Congressman Perlmutter has any inside scoop on the FDA above that, but it will not be in time clearly to vaccinate children before this fall semester, but it should be in time to start vaccinating children before the spring semester. They probably won't be fully vaccinated before they restart in the spring, but I'm truly hoping that the FDA will get that approval through in time to start vaccinating those younger kids over the winter.
So thank you, Dr. Comstock, for kicking that to me. We did have a conversation with the White House a couple days ago on subjects like this, and they said the FDA and the different pharmaceutical companies are working night and day on this for this emergency use authorization. I think that they were being conservative, and they said towards the end of the year, November, December, but I do know that there is really an effort to move that forward, but obviously safety is a huge concern, and we just want to make sure, even in an emergency setting as we have, that these things are as safe as possible.
All right, thank you, Congressman. Sorry that I interrupted you. Anders is next. Go ahead.
Yeah, thanks so much. I know that this is a hot button question, but I was wondering, because of their position as essentially caregivers of our students, if Dr. Comstock had any opinions on requiring the vaccination for teachers, or certainly encouraging, which I'm sure it already is. And I ask mainly because my children's school is requiring masks for all students and all visitors, encouraging vaccine reporting to the administration of teachers, but not requiring masks for teachers.
Thanks for that question, Andrews. I think I followed the end of it there about what your school's doing with your teachers. Jefferson County Public Health in collaboration with public health officials across the Denver metro area, we are looking at all options to try to keep kids as safe as possible. And clearly one of those options is to consider requiring teachers to be vaccinated, since they're the ones that are taking care of your children all day, every day in the school setting and interacting with them all day, every day in the school setting. At this point, other than Denver, most people on the phone call probably heard that Denver did put in a public health order that very recently that does require all faculty and staff at schools in the city and county of Denver to be fully vaccinated. Other than that, at this point, there is no public health order that requires teachers to be vaccinated in the Denver metro area, but we are the other counties in the Denver metro area are looking at this and strongly considering it. I'm not sure, Mike, would you like to talk about, as a school leader, your decisions about trying to weigh this? Really, it's a difficult decision if you make the decision to actually require vaccination. It's a difficult decision, and maybe Mike can talk about how he's thinking about it or what thought process school leaders go through.
Yeah, I'm in a fortunate position as a significant number of our faculty, 90%, are vaccinated, which makes me feel more comfortable. And I'm looking at the FDA to give final approval. It's certainly something I am weighing. I think it is the science is pretty clear that it's the right thing to do for us to move on from this virus. The one thing I would add is also, there are going to be teachers who have legitimate exemptions, medical exemptions, or maybe religious exemptions. We need to honor those and respect those. But there's other strategies we can use in terms of it. Like at my school, we're going to require our unvaccinated staff to test twice a week, and that will really cover us to minimize, spread at our school. But it's something we want to be thoughtful about and careful. I caught on your question the idea that teachers don't necessarily need to wear masks. I think that's I don't know your school, but that's certainly a challenging proposition if you're making your students wear masks, because we're trying to model behavior. But I do think I'm looking forward to the FDA making some final determinations and we can get some better guidance. Right now, if you're a school leader, whether you're private or public, it's a little bit of the Wild West in the sense of there's lots of, and it makes sense because local situations vary across the country, and that's understandable. And we don't want to impose a health regime in Colorado that may not be appropriate for conditions on the ground. But it's challenging for any school leader to make these decisions. And you want to be thoughtful, you want to be respectful of people's beliefs, but you also want to be clear on the science and the data and really look at that carefully. One thing I would recommend, the questions here are just fantastic that have come in tonight, but there's a great book by a guy named Adam Grant. He's a psychologist. He's actually a business professor at the Wharton School of Business, the University of Pennsylvania. He has a book called Think Again, and it really challenges readers to think about what we know and actually what we don't know. And I think COVID has challenged us to really examine. I think we can respond impulsively to this. And on the internet, we can see all kinds of data. We can actually see what we want to see versus actually rethinking our assumptions. And so as a leader, I've been really challenged through this whole crisis of really thinking, being thoughtful and looking at different perspectives, looking at different data sets, and being open to new ideas. And I would really encourage the audience here to either check out that book or a review of that book and actually question some of the assumptions you may have coming into it, because we are living in literally the fog of war. This is moving in a fast forward kind of manner, and it's challenging. And again, I'm really grateful for our partners at Jefferson County Public Health and the strong work they do, as well as any public health official right now to try to guide us in this very difficult time.
So
all right,
can I jump? This is Tracy. Can I jump in just real quick?
You bet.
Yes.
Go ahead, Commissioner.
Okay. Thank you. So thank you, Mike, for that, talking about getting resources and talking about the book. I just wanted to kind of segue on that point, that if you Google COVID and books on COVID for kids, there are a lot of books for kids on COVID. And that between now and when we start school, might be really good for parents and kids to be spending some time around what do you mean by virus? What is COVID? Why do we wear masks? And some of these books could be a really good resource. So I just wanted to jump in on that.
Thank you, Commissioner.
So just to join the party, real quick, Roger, just to join the party on that, because Commissioner Kraftarp laid it up so well. Any parents out there who have children that may be a little anxious about wearing a mask to school, those younger kids, particularly if they're going off to kindergarten for the first time or the first time as a first grader, there are some really awesome coloring books now for kids where they can color in masks on other kids, other animals. There's a lot of really wonderful suggestions on how to help kids get used to wearing masks and how to help them understand why they're wearing that mask and what it means in terms of their protection. So, parents can help kids get ready to go to school by teaching them why they need to wear a mask and teaching them how to wear it properly.
Okay, thank you. Sorry to have interrupted you. Just as a quick reminder, you can participate in the discussion by pressing *3 on your phone. You'll be transferred to an operator who will take down some basic information and get you in the queue. That's *3 on your phone to ask your question. Dr. Comstock, do you want to talk a little bit about public JCPH school and healthcare guidance?
Yes, thank you. Thank you so much, Roger. Several people are asking in the chat as well as emails exactly what is the Jefferson County Public Health School and Child Care Guidance and how does that differ than what your school is doing. So I'd briefly like to go over what our school and child care guidance is. It was released in late July, and there are 5 main components of this guidance. Again, this is a guidance document, so at this point they are strong recommendations. But it includes layering different viral mitigation techniques, including vaccination, mask wearing, isolation and quarantine, testing, and empowering parents and caregivers. We have recommended that schools adopt these evidence-based strategies to keep their students, faculty, and staff as safe and healthy as possible, and to avoid, or at least to the extent possible, minimize the number of disruptions due to having to be pulled out of school for isolation periods, quarantine periods, and outbreaks. In terms of vaccination, clearly, this is the first and most important weapon that we have in this fight against COVID. So we strongly encourage schools to promote COVID-19 vaccination for everyone who is eligible and to ensure the vaccination rate among their faculty and staff is nearly 100%. Those adults that are caring for your children throughout the school day should be vaccinated. We'd also recommend that the rate among eligible students is at least 70%. And finally, we recommend that to prioritize in-person learning and protect it, that all adults and students participating in school-based extracurricular activities should be vaccinated. If a student's not eligible for vaccination due to age or a religious or medical exemption, then to participate in extracurricular activities, they should undergo weekly testing as an alternative. Vaccines are the leading public health strategy for stopping the spread of this virus. Next is mask wearing, an additional layer of protection for in-person learning. We recommend that everyone age 2 and older, regardless of vaccination status, wear a mask when indoors at school. This includes students, faculty, staff, volunteers, and visitors. That next arrow in the quiver to fight this virus is testing. We recommend that each school should implement a COVID-19 testing policy. Parents should be required to report a positive COVID-19 test to the school's health official. All individuals experiencing symptoms of illness, regardless of their vaccination status, should take a molecular PCR COVID-19 test to be sure that they are not infected or to find out if they are. And if they are not, to present a negative result before being allowed to return to school. And finally, all unvaccinated staff, as well as unvaccinated students participating in school-based extracurriculars, should be tested at least weekly throughout this school year. The next recommendation regards isolation and quarantine. Regardless of vaccination status, all individuals who test positive for COVID-19 are required to follow isolation instructions. This is still a state mandate. This is still required by the state. Additionally, unvaccinated individuals, including all students, faculty, and staff, who were unmasked at the time of an exposure to a case are required to quarantine. The definitions of a close contact have been revised slightly. In the school setting, the definition of a close contact is now being within 3 feet of a case for a cumulative total of 15 minutes over the course of a 24-hour period. In all other areas of Jefferson County, it's a 6-foot distance, but understanding just how crucial it is to get kids back to in-person learning, it's been narrowed to a 3-foot distance. If you're masked and you have an exposure, you will not be required to quarantine in Jefferson County this academic year. Again, this is a concession that's being made to try to keep kids in that in-person learning experience. So, yet again, masking is so important that if you are unmasked and you are exposed, you will be required to quarantine. If you are masked, you will not have to quarantine. And then finally, we want to empower parents and caregivers. You deserve access to the information you need to feel that you can make the best decisions for your children's health and safety. That's why we're recommending that schools report those vaccination rates, their mask requirements, or their mask policies, their testing policies, and other viral mitigation efforts. This was only a quick summary of all the guidelines. Parents and caregivers can find the full guidance document on our website at www.jeffco.us/coronavirus. Just look under the Info for Public Health Partners and Businesses tab. Again, all of these recommendations are intended to achieve that one overarching goal. We've got to be able to keep our kids in school, in person, this academic year.
All right, thank you, Doctor. We're a little over halfway through the call tonight. We've had some great questions. As a reminder, you can participate by pressing *3 on your phone. An operator will take down some basic information and get you in the queue. I'll also mention that Congressman Perlmutter had to drop off at 7 to get to another engagement. We really appreciate him taking the time to join us for the first hour of tonight's town hall. We're going to get back to questions. Again, let's start with a question submitted by a parent in advance of the call. Here's that question. Does Jeffco Public Schools have to follow the guidelines of Jefferson County Public Health, or do they make their own final decisions regarding the COVID-19 school plan?
Yeah, that's a very good question. At this point, Jefferson County Public Health school and child care guidance are guidance. They are guidelines. They are very strong recommendations, but as of today, they are not requirements. That means that Jeffco Public Schools, as well as all other schools in Jefferson County, including Dr. Davis's school, at this point, they're allowed to make their own decisions. We are strongly, strongly promoting that they follow the JCPH guidelines. And this is where we will be very closely monitoring any signs of viral transmission in schools as the school year starts. And if my staff sees incidence rates going up, if we start seeing outbreaks and we can't get schools to at that point voluntarily adopt the guidelines, then I will be forced to step in and issue a public health order that would then change those recommendations to requirements. But as of today, JPS schools and any other schools in Jefferson County they are not required to follow the Jefferson County Public Health school guidance. They are only strongly encouraged to do so.
All right. Amber, you've been holding patiently. It's your turn. Go ahead.
Hi. Please don't cut me off before I'm done. It seems like some people have had that happen. But I'm wondering, once you've come out of quarantine from natural exposure, why should you still be expected to vaccinate and eventually even be possibly required to? And I feel like there's more focus on the numbers of exposure, which usually end in successfully surviving it, as opposed to the number of deaths. And how do the deaths from COVID exposure compare to the deaths of the vaccine itself? Okay, I'm done.
Yeah, thanks, Amber. Several good questions rolled in there. Let me try to start at the beginning and get all the way through, and hopefully I won't forget any of them. Thank you. So your first question was the difference between natural immunity and immunity through vaccination. You are absolutely correct that once someone is exposed and contracts the virus, that they develop immunity as a result of that natural exposure. That's what we call natural immunity. The issue is that everybody's response to being infected with COVID, it varies. Some people have very strong immune responses that last for quite some time based on the antibody tested that's being done in several large studies in the United States and around the world, whereas other people have more minimal immune responses and their immunity seems to wane much more quickly. Right now at this point, and it has been consistent for quite some time, using all of the data that's available and looking at kind of the average setting, the CDC is saying that natural immunity should be considered to be available to a person that's been infected for 3 months. And after that time, you're considered to be susceptible again. Your natural immunity has waned too much after that 3-month period to be protective. Immunity through vaccination works in a slightly different manner, and it is much, much more consistent across individuals. It elicits a stronger immune response in most individuals and an immune response that lasts much longer in most individuals. Again, there are a few individuals like those who are immunocompromised where it may not work quite as well, but the vast majority of individuals have much stronger immunity that lasts much, much longer if they're vaccinated rather than if they are naturally infected. There was a very good study that just came out that looked at individuals who had been infected with COVID, and then over time, some of those individuals decided to get vaccinated after that initial natural infection. Others chose not to get vaccinated, and they looked to see what the reinfection rate was in those two groups, and they found that individuals that were vaccinated were half as likely to be reinfected than individuals who were unvaccinated. That really shows that even if you have already been infected with COVID, you should go ahead and get vaccinated. It's going to boost that immunity that you have, and it's going to keep you much more protected than relying on your natural immunity alone. So that was the immunity question. Your second question, Roger, can you help me out on what the second half of the question was? Because it went away in the chat.
I don't recall now. I apologize. Does anyone else on the call recall?
Yeah, this is Mike. I think it was a question about the death rate from COVID versus death rate from vaccines, which I think would be an important question.
Yeah, thank you, Mike. Thank you so much. That's a crucially important question. That is a piece of misinformation that is unfortunately being circulated around social media. I'm going to be frank, folks. I am so concerned that any parent or caregiver may believe this, that I'm not even going to call it misinformation. That is a lie. That is a lie that is circulating on social media. It is simply not true that more people are dying from the vaccine than are dying from COVID-19 infection. Over 600,000 Americans have died from COVID infection. It is simply not true that more people are dying from the vaccination themselves. These vaccines are safe. They are effective. There are small numbers of people that do have side effects. Those side effects are being monitored closely and are mostly quite mild. It is absolutely a lie that more people are dying from the vaccine than are dying from the infection itself. So please, if you are seeing that information on Facebook or Twitter or whatever social media accounts you look at, please, I urge you in the strongest possible terms to go look up on reputable sources for yourself so you can see that that simply is not true. Please do not hesitate to get a vaccine because of that piece of information that's out there.
This is Dr. This is Mike. One thing to that. The internet is not, there's no editor. People can put whatever they want out. And the reality is you have no major news sources, whether they're left-leaning or right-leaning, that make that claim. If there was any evidence to that, any news source would jump on that immediately, and that hasn't been the case. And I agree with Dr. Comstock. It's an absolute lie.
Okay, sorry to have jumped in there. Let's go to Mike next.
Hi.
Go ahead.
I have, I've got two daughters who are in Jeffco schools. One's just starting middle school, so 6th grade, and the other's in high school. And I love all the information that Dr. Comstock has put out tonight about encouraging mask wearing and vaccination. That's all great. But as I read through the Jefferson County Public Schools fall health protocols, where it strongly encourages mask wearing but doesn't require it for basically 7th graders and up, I just want to let you know that, so when my 6th grade daughter went to an orientation 2 weeks ago, they were all strongly encouraged to wear masks because the guidance hadn't come out yet, and only half of them wore masks. And my high school daughter went to her orientation today. Again, masks were strongly encouraged, but she said maybe 1% of people had masks on, including, no teachers. So my question to you is, I understand you're trying to make it a carrot, so encourage people to wear masks by not having to quarantine and stuff like that. But in practice, with my 2 examples of what my daughters have seen just in today and then a couple of weeks ago, the kids are not going to wear masks unless it's mandated. And what's going to happen, even though you want to keep kids in school, is you're going to have so much outbreak because of the contagiousness of the Delta variant that they're going to end up not being in school because they weren't wearing masks. So I know it's kind of a catch-22, but without mandating the masks right now before they start school next week, they're going to end up not going to school.
Mike, this is Mike Davis from CA. What a great question. Just, I feel your pain. And there's kind of a related question from Angela about kind of how are private schools mitigations different than public schools. And I think at this point, individual school leaders, because it's a recommendation, are kind of left to make decisions. And clearly Jeffco has made a decision. I'm not affiliated with that. I can only speak from my perspective as a school about how you manage it. And I think there's several things that as a school leader we need to think about. And I would encourage you, I think you have, your property taxes are paying for public schools. So you have an opportunity to raise a voice, to talk to administrators, to have that conversation, just like parents at my school have these conversations. And, my goal as a school leader is to keep things open. And I think you're nailing on the head that this is a highly contagious variant that can shut down a school's operation, and talking to administrators about that. And also making decisions as a parent and help empower your child. It's going to be hard for some kids. I'm going to have parents at my school who are both unvaccinated and vaccinated who are going to want their child to wear a mask. And I completely respect that. As school leaders, we need to create an environment where people feel safe, where people feel that they can make decisions that are in their best interest. And that also, as a school leader, we want to keep school going. So I think I think it's worth having a conversation with your local school, raising these concerns, raising these issues. I think ultimately, as I look at this, I know masks are going to make it possible for our school to stay open as long as possible. And again, I think I can come back to what we do once rates lower in Colorado. But the data in Jefferson County of infection rates among the youth are really alarming, and I think we need to pay attention to that. And although I will have parents who will just say, hey, listen, the mortality rate for kids is minimal. I have a student population of 1,000. I've had some kids who got it and were long haulers and were hospitalized. It's a tough thing. And I don't want, as a school leader, to contribute to a potential illness that has long-term effects for a child, or even death, as remote as that might be. And I think we can put a mask on, and we can be smart, and we can really make sure we stay in operation, and we give the kids the psychological support they need and the human connections that they need. And again, we're talking about wearing masks indoors, being outdoors, and we're trying to pivot as much as possible to outdoors when it's good weather. Can really make a difference. So thanks for the great question, and I think you're nailing a real conundrum for so many parents right now across the nation.
All right, thank you. Really great question so far. Dr. Davis, maybe this is a good time to have you talk a little bit about some of the ways your school is working to keep students, faculty, and staff safe this school year.
Well, thanks, Roger. And again, I really appreciate the fact that Jefferson County Public Health asked my school, Colorado Academy, to join in tonight's conversation. Jeffco has been a tremendous resource for us this past 20 months as we are getting ready to return to campus. And I want to give a special thank you to any of our families joining, but I'm really appreciative for all the participants. Like, these are tough times here, and I really appreciate everyone being on the line and raising these questions and participating in this important civic dialogue. CA, we're fortunate because we have the gift of time, because we're not starting class until August 24th. So I am actually watching the experiences of other Colorado schools as their students return to class. Their first weeks may provide important initial lessons and allow us to refine our mitigation strategies. We're going to meet with our families next week, and I'll reserve details until then. But I do echo what our health professionals at a local and federal levels are saying. In-person learning is our priority. So what strategies can we implement to make sure that we are in person for as many days as possible. I am very grateful that the Jefferson County Public Health has looked at their quarantine guidelines and made some changes because that will really help us. And we found last year that when we had students who were exposed to COVID, they did not transmit on campus when they wore masks. And that's a huge win to be able to keep school going and not interrupt. So we're trying to balance the needs of all of our students to ensure a healthy and safe environment while creating a productive learning environment. And so the layered approach to mitigation exposure and the spread of COVID-19 served CA very well last year, and we expect to maintain many of the same protocols this year. What stands out for me now, and I really want to emphasize this, and I teach seniors, so I'm in the classroom with kids. How resilient students are at all age levels, and we often talk about what from the past year we'll keep moving forward, and I hope it's just that. It's resilience, knowing our kids can manage this, and we model as parents and as adults how they respond to this. And we have students from all different perspectives, all different backgrounds, and as parents, I really want to encourage you to think about how you talk about this in your home, how you manage the anxiety, because the students, your child picks up on this. We had a lot of fun at the end of last year with outdoor events and assemblies. I think this is something we're going to continue to the school year, trying to be outdoors as much as possible. And that said, we were and will continue to be mindful of the social and emotional impact that the pandemic has had on students and faculty and staff. I think it's really important to not overlook the impact of this pandemic on teachers. Like professionals ever, they too were forced to juggle work with children's schooling. I want to commend teachers everywhere for the job they did, and we'll keep this going in the coming year. I think teachers are really trying to focus on what is happening in the classroom, whether it's public or private. It's hard to do, but I know public school teachers and private school teachers, and they kept learning going as best they could during difficult times. I'll stop here, and again, I want to thank the Jefferson County for including Colorado Academy in tonight's town hall, and I look forward to questions, and I apologizing in advance for not giving specifics to our plan, but it's best that our families get that information first, but we're definitely looking at the ever-evolving situation.
All right, thank you, Doctor. We are going to be taking questions now for the remainder of the call, so if you have a question for Dr. Davis or any of our panelists or presenters, just press *3. You'll be transferred to an operator who will take down some basic information. I'm going to ask you to be as brief as you can when you ask questions, and our panelists will be brief if possible on the answers so we can get through as many questions as possible. Alexis, you are first up. Go ahead.
Hi, I was cut off earlier, so I actually didn't get to ask my full question, but I'm just going to change it up. Have any of you read the mask efficiencies that were published before 2019? That's it. Thank you.
So, Alexis, I really appreciate your perseverance to call back in when you felt that you hadn't been able to ask the question at the first time. I'm very committed to making sure that this town hall hears from all parents that we can in the time allotted, and everybody has a chance to ask their question and voice their concerns. I will tell you that my job as Executive Director of Jefferson County Public Health is to review all of the information that I possibly can, to read all of the scientific articles, to stay in touch with what all of the experts around the world, around our country, here in our state are talking about and recommending. And then at the end of the day, my job is to collate, assimilate, evaluate all of that information and to use my best professional judgment to make the decisions that I truly feel are in the best interest for our communities in our county. And that is what I do. So I very much appreciate all of the parents who have sent me information and asked me to look at it and asked me to read it. I've tried to share the favor and send links to scientific articles or links to CDC scientific guides back to many of the parents who have reached out to me. So, yeah, I can tell you that I have read and reviewed a great deal of information, and I will continue to do so in this very very rapidly evolving area of scientific study, I think it's really important for all of us to kind of take a step back. It's been so hard because we've been fighting this virus for so many months now, and it's weighed so heavily on us. But I think we really need to take a step back, take a deep breath, and realize that this virus has only been known to us for less than 2 years. This is still a relatively novel virus, and scientists and physicians and folks have been working around the clock, just tirelessly, to learn as much as we can about this virus as quickly as we can. And what we know today about how the virus is transmitted, to whom, when, in what settings, is so much more than what we knew at the beginning of the school year last year, that I truly feel confident that the recommendations that we're putting out, again, the Jefferson County Public Health recommendations are very highly aligned with the recommendations of the CDC, the American Academy of Public Health, CDPHE, and many, many other expert organizations. I truly feel that these layered viral mitigation strategies are going to enable us to keep faculty, staff, and students as safe as possible in that crucial in-person learning environment. So again, thank you for your persistence, Alexis, and good on you for getting in twice. I really do appreciate the question.
All right, Natalia, you're next. Go ahead.
Yeah, thank you for taking my question. As a parent of 2 children who are also in school and who struggled severely through last year due to all the restrictions and being separated from other friends and students and having partitions on their desks so that they wouldn't be able to see not only their friends' faces, but feel like they couldn't do anything, touch anyone, share a pencil, stand close to each other, that lack of connection, feeling like they're always doing something wrong. It created anxiety in them, not because they were concerned about contracting a virus that has almost no effect on them whatsoever. Yes, there are some children who suffer, but the vast majority do not. And if we're going to talk about statistics, then statistically, children are suffering far more from mental health issues than they are from the actual virus. And yet that is being overlooked. How is that going to be addressed? Because as Congressman Perlmutter was talking about his wife being a teacher and how she really wants to go back to in-student learning. Well, I'm a mother with children currently in school, and with all the other parents calling in and saying, why is vaccines not being mandated and what have you? Excuse me, those are my rights, whether I want to vaccinate or not. And how dare you guys try to determine what we will and will not do? How is everything else going to be addressed?
Mike, this is a good question.
Natalia,
for you
yeah, thanks, Natalia. I'll try to address this, and I obviously can't speak from the larger public school system or the government's position. There's a doctor in front of my name, but I'm not a medical doctor. I have a PhD in American history, and I specifically focus in military history. And I think that if we look back to World War II, we made tremendous sacrifices as a nation to take on an existential threat. And when I look at the data, when I look at the evidence, 600,000 Americans have lost their lives. This is a tragedy that was probably avoidable. And I'm not pointing to any particular political party. I think the nation, as our system, failed. We failed to recognize our common connection as humans. And our relationship to one another. I've had families at my school who've suffered terrible losses that were unnecessary. I have been in education for over 25 years. I see kids. I've seen them grow. I see them deal with challenges. We can put this in perspective for them, that we're making sacrifices for the greater good. And past generations have done that, and it's preserved freedom in this country. I think I am so optimistic for this year because I think we have vaccines. We have the ability of masks and different things to mitigate the spread. I think the school year will be different at schools across the country, despite the growth of the Delta variant. But we have an opportunity to manage to live with this in a way that will be much better than future years. And I'm very confident that that will happen for both public and private schools and charter schools. Again, individual leaders are going to have to make choices that depend on what's best for their student population. There are schools that are operating where they think COVID doesn't exist and there's no mitigation strategies, and parents can have a choice to look at those schools. But I think we have I personally believe we have a responsibility to the greater good, and we need to model that, and that's a patriotic thing to do for our country.
Okay, let's hear from Lindsay next. Go ahead.
Yes, thank you. I'm wondering why JCPH has decided to implement stricter quarantine guidance than CDPHE at this time, knowing how damaging quarantines were and how very, very low the transmission was based on the data from the many superintendents.
Yeah, thank you, Lindsay, for this opportunity to talk about quarantines. I mentioned earlier that this is still a relatively novel virus, and we've learned so much about it in such a short period of time. And school leaders and public health leaders have changed our recommendations and our guidance as we've learned more about this virus. This is an excellent example. There have been many, many changes to the quarantine rules this year to try to make sure that we're quarantining fewer students, so they're not constantly having those disruptions where they're pulled out of in-person learning and sent home. I'll give you just a few rundowns. First of all, CDPHE did change that definition of a close contact. Again, if you're tested positive, you're a case, you have to be isolated, period. That's a state rule, no way around it. But the quarantine rules are a little different. You're quarantined if you're identified as a close contact of a case. So CDPHE did change their rule, and this year in the school setting, the definition of a close contact is being within 3 feet of a case for 15 cumulative minutes over a course of 24 hours. That's a much smaller distance than the close contact rule being applied everywhere else in Jefferson County. So that's a huge advantage. It means fewer children will be quarantined when there is a case in their classroom. Secondly, CDPHE has changed the definition of an outbreak and has changed the guidelines for us here at Local Public Health on how we count the number of outbreaks in a school. Again, this was done to try to make sure that it was done based on the evidence that has built up over the last year. We learned a lot last year about what works and what doesn't work so well. And based on that, they changed the definition of an outbreak slightly. They changed the instructions to us on how we are to count the number of outbreaks. And again, this should really minimize the number of students that are infected by quarantine because of outbreaks. So those are just 2 quick examples. The third one is the decision that I have personally made as the director of Jefferson County Public Health to state that I will not impose quarantine on anyone who is exposed while they were wearing a mask. That is how confident I am that mask wearing reduces your risk of infection. So if you are defined as a close contact, but you were wearing a mask at that time of exposure, you will not have to quarantine. Those are several examples of what we've done to try to ensure that we have fewer kids that have their in-person learning disrupted by those quarantine rules. And now to get back to Lindsay's actual question, though, and I promise, Lindsay, I didn't forget it. I was just setting it up. Her question is, why am I imposing a stricter quarantine rule than CDPHE? So CDPHE did release their school guidance. Just like my guidance at Jeffco level, their guidance are recommendations. They are not rules or requirements. In one piece of that document, they did make a recommendation that in counties with high vaccination rates, over 70%, where Jeffco County falls in that status, CDPHE recommended that children in schools in counties with that high level of vaccination could be allowed to forego quarantine, even if they were identified as a close contact. I'm not going to do this in our county. I feel strongly about this, and let me explain why. I truly believe that the virus doesn't care if you were in a school setting or not. There's just nothing magical about walking through a school door versus walking through any other door to any other building in Jefferson County that somehow protects you against the virus. And I'll give you an example. I truly believe that we should be treating everybody in Jefferson County fairly. So if a 12-year-old was exposed to a case and meets the definition of a close contact in their Sunday school class or in their Boy Scout meeting or in their indoor soccer game, they would have to be quarantined. It doesn't make any sense at all from a scientific standpoint or a public health standpoint to say if that same 12-year-old was exposed inside school, they would not need to be quarantined. That just doesn't make sense. So I definitely have made many changes based on the evidence to ensure that we are dramatically reducing the number of quarantines that will be put into effect. Again, really understanding how important it is to prioritize keeping those kids in in-person learning. But the one that I just can't follow CDPHE on is this idea that just because you're exposed inside of a school, you don't have to be quarantined when you should be quarantined if you had that exact same exposure any place else in Jefferson County. I don't see any evidence for that, and I can't rationally see any scientific or public health reason why that exposure would be less risky within the school setting than it is outside of those school doors. So I very much appreciate you calling in tonight, Lindsay. I appreciate your question. That's my answer.
All right, thank you. Let's hear from Ashley next. Go ahead.
Hi. Thanks for taking my call. I'm a once and future teacher. I'm a mother of 2 Jeffco students. My children currently attend a charter school. They won't be there for long because their charter school is refusing to comply with the Jeffco Public Schools masking requirement. They say they will only take a public health mandate, which means even though I've spoken to the school, they don't care. I've spoken to the charter school superintendent for all the schools that are charter schools. He said the same thing, got to be through the public health. I went to the superintendent of Jeffco Public Schools up to the top. They said, charter schools have autonomy. But the thing is, just because a charter school has autonomy, that doesn't mean they should do whatever they want. They should do the right thing for everyone. And this school is not interested in doing that. And I am asking you as a parent, this is more of a statement than a question, but my question is, will you please put in a masking mandate for Jefferson County? Because they're saying it's on you. And I'm asking you kindly, please. My son, he's 11.
Thank you, Ashley.
Sorry, I thought I got cut off.
No, please finish.
I just wanted to say he will be in school for 2 months before he can even get the first dose. And I am terrified to send him back because they've already said that nobody has to wear a mask, whether they're vaccinated or not, no matter how old they are, whether they're students or parents or teachers. And that just feels violently irresponsible to me. That's all. Thank you.
Ashley, thank you so much for sharing your question tonight. And, clearly I can hear how passionately you feel about this. And I understand. I understand. Every single one of you parents, no matter which side of the mask mandate issue you're on, you truly believe that you need to have the ability to do what you think is in the best interest of keeping your child healthy and safe. I understand that, trust me. As we can see from the callers that have called in today, parents just feel differently about what that means to them, what it is to them to keep their child safe. That's what is making this just such a challenging situation for school leaders and public health leaders. I will be frank that I had hoped that the very strong recommendations I put out in the JCPH school and child care guidance would have motivated schools in Jefferson County to adopt the guidance, or at least more of the guidance. I will say that I am quite proud of the leadership shown by JPS Superintendent Dorland. She was the first major school district in the metro area to require universal masking, at least for those children under 12. Since then, some school districts in our metro area have come out with stronger requirements. Denver Public Schools is requiring masking for all, regardless of age or vaccination status. Boulder Public Health put out a PHO requiring all students in Boulder to wear masks regardless of age or vaccination status. There are some other school districts that clearly have announced that their decision is to leave it up to each parent to decide whether or not children are masked or not masked. I completely understand how that terrifies you. I do. To know that you don't have the ability to protect your child from a child who may be sitting next to him who is unvaccinated and unmasked. I don't blame you. I have a nephew who's 11 who's going to turn 12 in October. And he's a little bit of a precocious kid. He has looked this up. He's studied this. Many of you parents who are on the call would probably like him because he doesn't always believe Aunt Dawn just because she tells him something. So he has researched the virus for himself. He's researched the vaccine for himself, and he is angry at me because I can't make the FDA approve the vaccine for him because he wants that vaccine so he can go to school safely. Now, I'm not sure his motives are completely pure because he's admitted that the biggest reason he wants to be in school safely is so he can play on his soccer team. I think that has a little more to do for him than the education. But yeah, I get it, particularly for parents that are right there on the borderline with kids that are 11, and you're going to be sending them into classrooms of mixed 11 and 12-year-olds. And right now, JPS says in those mixed classrooms that it's okay for a 12-year-old to be unvaccinated and unmasked, even if they're sitting next to an 11-year-old that has to be masked. I don't understand that reason. I do wish that they had implemented the full recommendations. Again, I am trying to respect the authority and autonomy of school leaders to make the decisions that they feel are best for their school populations because they know their parents and their students and their ventilation systems and their spacing ability and everything else, better than I do for each and every school in Jefferson County. Again, I promise you, though, that my staff is watching with an eagle eye from day one of schools. And if we see incidence rates starting to spike, if we see outbreaks starting to happen, I will put in a public health order that requires masking for all ages, regardless of vaccination status in Jefferson County.
Okay, let's hear from Martina next. Go ahead.
Hi, so I had a question, for us parents who don't necessarily trust the CDC recommendations because of the back and forth and everything that's gone on with that. How many other sources have gone into your decision making for public policy, like the frontline doctors? Have you looked into any of that kind of research too about recommendations for how to handle, outbreaks and things like that in schools?
Yeah, thank you, Martina. That's a really good question because, I understand these are, let's just call it interesting times in our country. And, there's just been so much mistrust and everything is so charged. And I understand that, everybody might not consider the same resources I consider to be valid resources. I acknowledge that. So if there's parents that don't trust the CDC, my first recommendation is even if you don't trust the CDC, please go to that CDC Science Brief that I referred to you because it includes a reference list at the bottom of almost 100 peer-reviewed scientific articles. Now, the CDC did not write those articles. A peer-reviewed article means that a researcher out there did a study, they did research, they wrote up their findings, they submitted it to a medical or public health journal, and other experts in the field read that paper and determined its value and its worth and its validity. And only the vast majority of these medical and public health journals are incredibly competitive in terms of what gets published. Only the best research gets published in these peer-reviewed journals. So if it's published in a peer-reviewed journal, you can have a much higher degree of confidence in it compared to what you might read on Facebook or what you might see in YouTube. It's called going to the original source. So if you don't trust CDC, okay, I get it. You don't trust the government. But you should be able to go and read those articles for yourself. And after you read them for yourself, then you can look at what CDC's recommendations were, and you can decide for yourself if you agree with them or not. So source material is something that I rely very, very heavily on. Even though I do trust the American Academy of Pediatrics and I do trust the CDC, I don't just take them at their word. I read the citations, the source articles that they provide, that they say they're basing their guidance on. And I guess the other recommendation I would make to parents who may be a little uncomfortable trusting certain sources is, what are your trusted sources? Find a source that's trustable for you. I've heard from some parents that say they don't trust the American Academy of Pediatrics because it's a national organization. Okay, I've got a letter from 800 Colorado pediatricians that make the same recommendations. It's the Colorado chapter of the AAP, but these are your pediatricians. These are pediatricians that that you take your child to, that you trust. And they're also encouraging people to follow the AAP guidelines. Similarly, I read that point that was in Colorado Children's Hospital's their own review of the literature on masking. I read that because I know that some of the parents out there don't trust me. I understand. I'm part of the government, and if you don't trust the government, you don't trust me. I get it. I'm sorry for that, and I'll do what I can to rebuild your trust and try to gain your trust. But if you don't trust me, goodness gracious, I don't know of a single parent in Colorado that doesn't trust Colorado Children's Hospital. I mean, goodness, they're the preeminent medical hospital for pediatrics in our state. And when Colorado Children's Hospital puts out information that shows you that masking is effective in schools, I would hope that you would trust that information. But even in their document, they provided the references upon which they based the information. So you can go read those research papers for yourself and decide if you agree with them or not. So find a reputable source and go to the original sources and read it for yourself. If you don't trust people, then if you don't trust CDC, if you don't trust people, great. Go out and find those original sources, read them for yourselves so you can make your own determination.
Okay, we're going to hear from Lisa next. Go ahead.
Oh, I think that's me. That was a surprise. I'm so sorry. Hold on one second. Okay, so I just wanted to ask about our newest Jeffco rules say that if a student is exposed in school, whether they're vaxxed or, if they're exposed to someone in school, like they're sitting next to a kid who's positive, if they are unvaxxed, they have to quarantine. If they're vaccinated, they don't. But I'm a little confused by that because what I'm reading, and correct me if I'm wrong, is that vaccinated people, while they're healthy or healthier when they get COVID, they don't get as sick, they do contract COVID and they are contagious. So shouldn't anyone who's unmasked and exposed be quarantined?
Sorry, I forgot to take myself off of mute there. Lisa, that's a really, really good question. Thank you for it. And, I think there is a lot of confusion. Vaccination is highly effective. It is slightly less effective because of the Delta variant, but it's still highly effective. It's still 80% or more effective in preventing actual infection from COVID-19. Yes, you're hearing more about breakthrough cases. A breakthrough case is when someone who's fully vaccinated still contracts COVID-19. And you are absolutely 100%. Originally, it was believed that if you were fully vaccinated, even if you caught COVID, even if you were infected and you had an asymptomatic case, that you probably weren't spreading vaccine. But you're right. Newer research, as I said, we keep learning more and we adapt as we learn more. Newer research has definitely shown that even fully vaccinated individuals, if they are a breakthrough case, some of them are shedding large viral loads and they can infect others. So you are right. So why does this make sense? It makes sense because the vaccine is still highly effective. So the odds of a vaccinated student sitting next to a case and being exposed, the odds that student is going to be a breakthrough case are still pretty low. We are watching that as well. And if we see that the rate of breakthrough cases continues to rise, then that's a policy that we may very well change our decision on. Right now, based on the evidence that we have, the odds of a fully vaccinated individual who's exposed in that school setting becoming a breakthrough case who is also a high transmitter of virus, it can happen, but the odds are low. If we see the data change, then absolutely I will change my decision, and I will say that even fully vaccinated individuals, if they are a close contact, will need to quarantine if they're not masked. That's another thing that we'll be keeping a close eye on as kids go back to school, and if needed, we will change. But at this moment, if you are a fully vaccinated individual and you meet the definition of a close contact, you don't need to quarantine unless you start showing symptoms, and then you need to be tested and see if you are in fact a case. But you don't need to quarantine if you're a fully vaccinated individual. And again, my decision, because I'm so adamant about prioritizing in-person education, my decision at this point for Jefferson County is that fully masked individuals who are sitting close enough to a case to meet the definition of a close contact, they do not have to be quarantined at this point.
All right, let's hear from Amy next. Go ahead.
Yes, thank you for taking my question. I am wanting to kind of bring attention back to earlier in the call. A man asked about the mental health and what are we doing about the mental health with our children and all that they've suffered over the past year or so. And it was, in my opinion, lightly touched upon. Y'all referred to there being plenty of resources. However, you also stated how reputable the Children's Hospital of Colorado is. They just put out an article that they're quoted saying their tank is empty. The chief medical officer of the hospital was quoted saying our kids have run out of resilience. Their tank is empty. That's where we are right now as a system, and it's impacting families across our metro area and across our state. It was also quoted later by another person that there are not enough resources. I have been to the emergency hospital rooms at Children's Hospital twice this summer where there are not enough beds for children to be put in because there are so many children suffering with mental health issues. So how are we going to realistically address this?
Amy, this is Mike Davis, a great question and a great concern. And I would say, if I was an entrepreneur or if I had unlimited resources, I would build far more mental health facilities for kids in this country. Again, my perspective, being in education 25 years, we've had a mental health crisis for adolescents that predates COVID. And I'm not at all trying to de-emphasize the impact that COVID has had on kids. I see it. It's hard. I've also seen kids kind of manage it and rise above it, but we're in a challenging situation. I think parents, we are not equipped to deal with social media. I say this as a parent of 3 kids myself. This is a whole new reality for us in terms of managing our children on social media, what they see and how that impacts them, and then also the isolation of COVID. So what I would urge you to do, and I don't have an easy solution to this, and I think I know I can only speak from my lived experience at my school that we care deeply about mental health and we're focused on it. And we're trying to engage and bring in resources. I think it's up to parents to talk to their local school to make sure their principal and administrators are thinking about this, to work through their parent association or their PTA to raise money, to bring in counselors, to look for those resources. I also think it behooves all of us to really think about how we're parenting our children, how we're monitoring social media. I would give a story of, we have kids who, like, if you look at Snapchat, I think parents, we think just solely of Twitter and Facebook, but Snapchat has this terrible feature which allows kids to see where their friends are. And if they're not included, it can have just devastating impacts on them. All these factors and I think a lot of parents have, because they want their kids to have connection, have maybe, let the gas off of really monitoring social media use. And that can have some really challenging consequences. I don't have a really good answer for you, and I wish I did. But I would just urge you to really talk to your local school people, engage the administration in these conversations, let them know what you're seeing and feeling, challenge them to bring more resources to bear. I think we need to push our state and federal government to really respond to this. I mean, this is a crisis. As much as I believe in the resilience of students, I don't want to undermine that. There was a story recently that there are, based on kind of census data, there are 340,000 kindergartners who have not shown up for school. This is a problem. So we really need, I think as a nation, we need to put kids first and really respond to this. Thanks.
Hey, Mike, this is Tracy, and I want to piggyback onto this. So what most people don't know is I am a licensed clinical social worker. My background is providing mental health services both to kids but also to families. And I was in the state legislature the last 8 years before I became a county commissioner. And part of my focus in the state legislature was on mental health. Our mental health system has needed help, including Children's Hospital, long before COVID. We here in Colorado, we fund those things that are constitutionally mandated, and mental health services are not. And that's a lot of blah, 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 blah. What is she saying? What I'm saying is, Mike, as much as I love you, and I think you've been absolutely brilliant, more beds is not the answer. That parents should know about the crisis hotline. It's about crisis because it means you don't have to make an appointment. It means if you're struggling with a question of something with your child, call them and ask them for help. We have crisis walk-in centers. All that, it's not about the crisis, it's about you don't have to have an appointment. You can walk in and be able to get help. Utilize the services here in Colorado. There's a lot of other programs that the legislature passed this year, and Congressman Ed Perlmutter talked about the money that's coming to Colorado, $550 million to go towards behavioral health. All of that is pretty high level. I know that when you're struggling with, how can you help your child, that high-level stuff is like, what is she saying? But there is resources out there. There is help out there, and I encourage you to reach out, whatever you can, to be able to help your kids. Okay, Roger.
Thank you, Commissioner.
Oh, one more thing. Colorado Crisis Hotline. Everybody get your pen. Got your pens? Okay, 1-844-493-8255. 844-493-8255. Or you could just Google it, Colorado Crisis Hotline. Thank you.
All right. Thank you, Commissioner. Well, we are at the end of tonight's telephone town hall. Dr. Comstock, do you have some final remarks?
Yeah, thank you, Roger. I just want to thank everyone who participated tonight and keeping such a civil and open discussion in what I know is a heated topic. I appreciate how challenging the past 2 years have been for our children and their families. I recognize how hard you've worked to keep your families and our greater Jeffco community safe, and I truly understand the many sacrifices you have made during this ongoing fight against COVID-19. I truly just want to take a moment to thank the people of Jefferson County for doing what you do best, working together to help everyone in our communities. I appreciate everyone's time tonight. I appreciate that you took time out of your busy schedule to attend our town hall, and I thank you. For more information about COVID-19 or to stay up to date on the latest news and announcements in Jefferson County, visit www.jeffco.us/coronavirus. And if you want to find out where to get a free, safe, and effective COVID vaccine, just visit www.jeffco.us/vaccine sign up. Thank everyone for your time tonight.
All right. Thank you, Doctor. We're sorry if we didn't get to your question tonight, but you can still leave a message at the end of the call. So just stay on the line and you'll be directed to a voicemail system. If you would like a response, please be sure to include your email address or a phone number. On behalf of Jefferson County Public Health, thank you for participating. Stay healthy and good night.